أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. I start in the name of Allah subhanahu wa ta'ala with this talk, which is inshallah going to be beneficial for everyone who's attending, as well as those at home who will get the message as we pass it on. And inshallah, as we pass it on to 10 people, and those 10 people pass it on to more people, we will all get the reward and ajr from it, inshallah. The topic is not a light-hearted topic. However, it is one that we must be aware of, inshallah. So, I'm going to go through it at a relative pace. If at any moment anybody has any questions, please feel free to just ask, and inshallah we can address it there and then rather than waiting for questions at the end. The talk will be quite detailed at moments, and at other times it will spare the detail. But if you do have questions and you feel like you want to ask personally, we can talk about it later as well, inshallah. The purpose of this talk is not to give advice, individual advice. If you feel like something is addressed here that you know of someone else who may benefit from it, or you yourself may benefit, then please see a doctor and discuss it in depth so that further test or whatever is necessary can be done, inshallah. So what are we going to do? We're going to talk about what cancer is. Can it be prevented? The importance of picking up on abnormalities early. The earlier we pick it up, the more we are able to do as doctors about it. As well as that, talking about the 3 main screening tests which are done in the UK. These are tests which everybody is able to do when they have certain age that they hit or a certain situation that they hit. So this is going to be something that if Allah subhanahu wa ta'ala gives us life, we will all be facing, because it happens no matter what. But at some point, you may need to do this earlier than others, and all that information will be discussed about the 3 main screening programs. These are for bowels, which will be for everybody, and then there's 2 mainly for the women, which is to do with the breast cancer and cervical cancer. Now, although there's gents here, I want everybody to be aware that most of the women, they would rely on us to be able to bring back information home, or to advise that, oh, I've got this happening, do you think I should go to the doctor? And that's the moment where you need to be able to say, yes, please go. Oh, it's fine, it's okay, because that's what we normally would do. It's fine, don't worry, it's fine, everything's fine. But there are certain points where we need to be having alarm bells ringing to say that, oh, this is not right, get it checked. So, what is cancer? Anybody here, can anybody tell me what cancer is?
Cell mutation.
So cell mutation. When we say that, you mean the Avengers or?
Well, cells that act as hosts within, ordinary cells that end up becoming hosts for cancer, so they effectively change shape and form.
Yes. So the key words that I'm taking away from what you just told me is that they change shape or form. So it's a normal cell which for some reason has started to change its shape or the way that it works, and by this it's disrupting all the other cells around it. And if it has the ability to multiply, then that's the moment that we say it's not just an abnormal cell anymore, it's a cancer, because it can multiply. If it cannot multiply, it's a bad cell, so be it. Eventually it will go away. But when it develops the ability to multiply, that's when we have the condition where we call it cancer. So it's a cancerous cell, or cancerous tissue, or a cancer in an organ, like the lung or the bowels or wherever it may be. So, what are the leading causes of death in the UK? Cancer is one. Anything else? So, problems with the vessels, whether it be in the brain, called a stroke, or be in the heart, called a heart attack. Yeah. So those, to be honest, those are the 2 biggest, and they're always competing to say which one does more. So as we can see, when you add together all the different abnormal cells in different parts of the body, cancer is the biggest killer. Now, I can see that everybody here has brown skin, which means that, you know, we're not from this area. Eventually, our ancestors go back to another land. Over there, we might not be aware of what our granddad or his father died from. A lot of the time, we just say old age. But more often than not, what we find in the UK is that because of the fact that we have the provisions, we find something wrong, which is normally cancer. So cancer is inevitably the biggest killer. But a lot of the times we don't find it, and alhamdulillah for us as Muslims, this country does not push for finding out why the person died if there's no reason to look for it. So we don't have to have autopsies. But if we were to, we would find that there would be even more cancers in the number up here. So something to be aware of, that cancer is important and therefore we should not ignore it. Now, if we say that, you know, there's a cell which can become abnormal, where is the cell? The answer to that is the whole body is cells put together to make different things. So similar cells make up the skin, and similar cells make up our heart, similar cells make up the lung. So all these cells, no matter where they are, can become abnormal. So in terms of types of cancer, there's thousands, but the common ones, there's around roughly 200. So there's a lot of variety, and we're only looking at 3. So we're keeping it nice and simple, inshallah. The most common are breast, lung, prostate and bowel. And it usually goes in that order. That breast is the most common cancer in the country, and then it's lung, and then it's prostate, and the fourth is bowel. So 1 in 2 people will develop cancer at some point in their life. This doesn't mean that this is what you will die from, but you will develop cancer. So the age of where we start to be scared that, oh, I don't want to do anything about it, what if it's cancer? Forget about it. Because 1 in 2, so that means that half the people in this room, at some point in our life, will develop cancer, have developed cancer, or might even have it now, but we don't know about it because it's very slow and it's not giving us any trouble. So the earlier we know about it, the more we can do. Every year, around 360,000 people. That's just a little bit under the population of Fulton Forest, which is 400,000. But that's the number of people who die from cancer every year. So imagine the whole of Fulton Forest disappearing
in UK only?
Yes, this is UK. So can be prevented. The purpose of this talk today, from the British Institute of Medical Doctors, is that we want to prevent this. The more that we can tell everybody about it, the more likely we are to have people go to the test and make sure that when they have a problem, they get it checked. So out of 10 people, if 10 people were going to develop cancer, we believe from current research that 4 of those people who would have got cancer might end up being saved if we pick up things early enough. There are some things that will happen, it will present too late, but at least close to half of them we can avoid. So if we can, inshallah, let's make sure that we spread the message on that.
Sure.
Now, you've all got some leaflets, and inside the leaflets you'll find this infographic, and it basically goes through somebody who smokes. So something that we're very familiar with, is very common in our community, in any community, but especially in our community because there's various things that you can smoke. We find that there's a list of 15 different types of cancers which you can get just from smoking. The biggest and the most common we know is lung. But would you believe me if I said that it can affect the smoking is the more primary cause of bladder cancer? Smoking is also the second most common cause of throat cancer after alcohol. So smoking also can cause cancer inside your kidney or your liver. Again, you don't see the relevance to it, but it's those, what you inhale, the effect of all of that can spread anywhere inside the body once it gets in. And this is a second infographic, and it looks at the biggest causes of cancer after smoking. So smoking is the most common cause. And you'll see on there that obesity, which again is something which is prevalent in our community, more so than the general population, can cause so many different cancers too. Yeah? And alhamdulillah, we enjoy our food. But a lot of the times it's to our own detrimental loss of good years of life where we can enjoy our time, be retired and enjoy all the tax that we've given. You want to rake in on the pension. But if you don't look after yourself for the 40 years, 50 years that you work, what's the point of paying into that pension? Yeah? You want to enjoy that time after you're 65, now 67, you never know how much it will be.
Your wife will enjoy it.
Unfortunately, in our community, even for females, the life expectancy is not that much greater than men. It's definitely nowhere near the average in the country.
What's the average age?
So average age of living in this country is 79 for men and 82 for women. That's the average. I don't know the statistics for the Asian population. But it's definitely not 79 or 82. And we'll all be sort of examples of that, where we would say, I know 5 people and these are the ages, and if we all share the numbers, it will come nowhere near that as an average. Now, alhamdulillah, you'll get some people who live a long life, but the average is a different matter. So, when we talk about food, we say that, oh, this is good, that's bad, but there's lots of misconceptions. And the idea of this picture is to try to clear some of these. So healthy food does not mean that you eat less or that you eat something which is fresh, so you're chicken. Healthy food means having a variety, making sure that you eat things which are going to not put pressure on your bowels, making sure that a lot of it is not going to go towards storage. You want the body to use the energy that you consume there and then. We don't need it for later. Alhamdulillah, we are in a country at least where food will not run out anytime soon. So what are we storing it for? I've got a list of things like vegetables, whole grain foods, fruits, healthy protein foods. But I will say from our own personal experience that you can pick one category and say, I will just stick to whole grain foods and nothing else. Even that's not healthy. Healthy things to have a variety. And eat within your means, have small meals. We have the hadith that first of all have 1/3 of water and then eat 1/3 with food and leave 1/3 empty with air. We should inshallah try to follow. First of all, this advice is to myself before anyone else, before someone sees me after Isha going, this brother was talking about food. And then the bad foods, so things to cut out, processed meat. We really have to be careful about what we eat and where we get that food from. Again, sugary drinks. A lot of that sugar, now there's, mashallah, very good education, and even on the bottles you've got little diagrams which gives you information about sugar content. So let's pay more attention to that. Look at the amount of calories. Has everyone come across breakfast bars? If you get a breakfast bar, so a breakfast bar, if you buy one which is supposed to be healthy, they will say that, 100 calories. Only 100 calories. Now, we'll have that breakfast bar thinking that we're being very healthy. And then we'll have dinner and we'll put, 1 tablespoon of mayonnaise. That 1 tablespoon of mayonnaise contains about 80 calories of normal mayonnaise, not light or extra light, but normal mayonnaise. And the same goes for ketchup. Ketchup has a little bit less than mayonnaise, but it still contains about 50 to 60 calories per 1 tablespoon. That's 5 chip worth. For some of us, you need to be careful that you look at the numbers, inshallah. Now, importance.
Brother, can I ask a question? If someone is diagnosed by cancer, so he already has cancer, and then he changes his diet. Does that really help him, or is it too late?
So the brothers just asked that if someone is diagnosed with cancer, does it matter if they change their diet? That's not the scope of this talk, but just to answer your question, it depends on what the cancer is, what level the cancer has got to, the chances of us being able to treat it with either chemotherapy or radiotherapy or cut it out. And then after that, they will need to have a healthy lifestyle to avoid their risk of cancer afterwards. So if I concentrate on that first, if you have good food and you exercise and you maintain a healthy weight and you don't do things like excessive alcohol or smoking, then it will reduce the chances of getting another cancer or that cancer recurring. But the cancer that you already have is there. It will be what it is. Unless it is treatable or curable, you will probably live longer if you're healthier. Does that make sense? Even with that cancer, but it won't necessarily treat the cancer.
Because I was told, that the cancer cells, they need a certain feed. And if you stop that feed towards those cancer cells, eventually it will just die. And all the normal cells will take over.
So the brother was just mentioning that cancer cells must have something that feeds them. So if you have a bad food, it's feeding the cancer. This is a common misconception. The cancer cell needs sugar from the blood, which it uses for energy. And it needs a protein from the blood as a building block to grow bigger or to divide and make more cells. This is the same sugar and it's the same protein that other cells are using to be able to maintain their function. So the ingredients that they need are the same. So if you deprive one, you deprive the normal cells too. Okay? However, if the cell is dividing abnormally, it's because of the fact that it has an inherent problem with it. The genetic code is messed up, or the cell has some bad protein in it, which is disturbing its function. Something along those lines. And normally, you will find that a lot of cancers are driven by hormones. So the more of a hormone you have, the more it drives that cancer. But in terms of the sugar that you have in your food, whether you increase it, decrease it, it doesn't. What makes the cancer go away is your own immune system. If your immune system, this is one of the problems with cancer, unlike infections and other problems, your immune system can tell that there is a bacteria, it does not recognize it as being part of the body, so it will destroy it. Yeah? The cell which is abnormal, although it's abnormal, parts of it are still the same as what the body has. So the immune system cannot identify it. Yeah? If the immune system can't identify it, it can't do anything about it. It leaves it alone and it lets it grow. Sometimes the immune system recognizes it and it starts to break up those cells. That's where you do see slowly that cancers can go away because the immune system is working better. This is an up-and-coming field where we are now starting to create new forms of therapy where we give a protein shake to the white cells, which fight immune system, fight against different things. And if we have now found that this is probably one of the better ways of fighting off cancer rather than chemotherapy or radiotherapy. But it's all research at the moment. There's no definitive treatment as such. So after many, many years of making lots and lots of chemicals, scientists have now realized that what Allah subhanahu wa ta'ala is doing is better. To facilitate that. I hope that answers your question.
Yes, absolutely.
So importance of screening test. So by screening, we can tell that there's a start of something abnormal happening. And if we pick it up at that stage, then we can get rid of it before it has grown into something which is substantial. Which means that you might not even have any side effects if we take something away. So this is why we like to screen, because we catch more people at early stage before the cancer has become a problematic thing. Yeah? So lots of people will say, I've had cancer, but you look fine. Nothing's wrong with you. And alhamdulillah, the reason for that is either they went through a very long, bad period and it took time for them to go back to normal, or it happened to be in this early stage, we caught it, we took it out, and alhamdulillah, a couple of weeks you forget all about it. And that's the benefit of screening, alhamdulillah. The way that screening works is by having a sieve. So imagine that this is your sieve, and there's some people who will fall within the sieve to say that these people are of a certain age, so therefore we will only be screening them. When we do the test, be it a blood test, be it a stool test, be it an x-ray or a swab, whatever it is, a couple of people will have a positive result. Now, rather than testing everyone by having a CT scan, MRI, and lots and lots of tests on everyone doing biopsies, we then say those two people are the most likely to have something wrong, and we will do those further tests only because research has shown that these are the most common people to be affected. So this is what screening means. Does that make sense to everybody?
Yes. Can you explain that again, please?
So imagine that in this room there are people, for example, one of the cancers which is screened for is cervical cancer. So anybody above the age of 25 and is a female will fall within this sieve. So that means that they will have a swab done. When they have the swab, they find that 2 of those swabs came back with bad cells. But we don't know the nature of those bad cells. So then these 2 people will go and have further tests. The benefit of doing that is we don't have to do the further tests on everybody. Number one, financially the country can't afford it. Our taxes go up. And we know how much we hate taxes. Yeah? But as well as that, it will mean that only a few people are tested and less people will have side effects on the whole sort of psychological side effects and the side effects of doing biopsies and all of these things. So that's how screening works. Does it make sense to all the sisters sitting in the back? What I mean by screening? Yeah? Please feel free to ask any questions if you have any, inshallah.
Yeah, but why would you have screening for those selected people and then apply it on the whole? Because
we know that women before the age of 25 are very, very, very rare for them to have cervical cancer. Never say never, it can happen, but it's very rare. So research has shown that it's so rare that to test another sort of, for example, if I put a figure to it, another 100,000 or 500,000 women for the same test means that it's a lot of cost and you won't pick up any. So that's why you take those away. For bowel cancer, we test people above the age of 50 or 55 or above the age of 65, whatever the different cutoffs are. Because anyone who's younger is very unlikely that they will have bowel cancer. People do have bowel cancer before that age, but it's very, very rare. So spending all that money to do a camera test up the bowel back passage on everyone from the age of 30, 40, it doesn't make sense because it's a lot of money and you don't find hardly any people who have that. Does that make sense? So just in terms of money, you have to decide a cutoff.
Is this a part of a study or is it specifically targeted?
This is national. Everyone has it. So the screening test is national.
Everyone has to.
Everyone has it. But you have to meet a certain criteria. For example, it could be age, it could be gender, it could be other risk factors.
That's why letters are sent out to everyone.
That's it, yeah.
Okay.
Because it happens automatically.
Okay.
If you're registered to a GP, it happens automatically. If we detect cancer early, then we are able to make sure that these people have a better chance of being cured or have a longer survival. So this is a diagram which shows that by doing the screening, we pick up 6% of those people who are screened as having some type of cancer. Out of those 6%, we pick up that 2/3 of those people will be picked up at a very early stage of their cancer. So it's pre-cancerous, which means that if we take those cells away, alhamdulillah, all gone. And 3%, which is less than 0.5% of that 6%, right, will be caught at a late stage. And unfortunately for them, it will just be a matter of managing and trying to make sure that they stay healthy for as long as possible. But that's not what we're concentrating on. We're concentrating on the bulk, to catch people early. That's the purpose of this screening. We know that if these people were to be caught when they get to that stage, it costs the health service more. It means that you're not able to work, so you can't pay taxes, and the whole system falls apart. So holistically, it works. Now, we've got 3 cancer screening programs in the UK, as I mentioned before. There's the bowel screening, which is a one-off camera test, and I'll show pictures later. This is where a long tube, which has a camera attached at the end of it, is inserted up the back passage to have a look at the bowel. By doing this, we're able to see if there is any polyps, which are small pouches which can grow in there, or a big lump, which would be an obvious cancer. If we find the big lump, that means that we've caught it too late. If it's a little polyp, we take it out, and then we check under a microscope that is it abnormal, and did we take all of it out, or is there some left? If there is, then you have to go back and take it out. So this is what we mean by a camera test. Now there's new tests which are being introduced into the UK, and these will be from April 2019, where you will be asked to send a stool test in a pot. You can post it, you will be sent it by post, and you post it away, and that will be tested to see if there's any blood in the back passage. When there are abnormal cells, they're not normally as strong, so they can leak very easily, and they can leak blood. So in the bowel, we can see that there may be blood from the back passage, which can be picked up by this test. If we know that there is blood, then we can do the camera test at a later stage, whenever people get sent out this in the post. And this helps us pick up bowel cancer. Does that make sense to everybody? So this is for male and female. It's for everybody. Yeah? The next one is breast cancer. Breast cancer is tested for by doing an X-ray of the breast. It is done between the age of 50 and 70, and you have a test every 3 years. There is very poor uptake of this because of the fact that women from our culture do not like the idea of having a test. Usually these are more, this is near enough a universal rule, unless if there's staff shortages. It is always a female who's attending who does the imaging. So there is normally no problem in terms of having aura uncovered in front of a male. And alhamdulillah, the uptake will allow us to pick up these cancers early, which means that you will have a better life. Breast cancer is a horrible disease. It may mean having lots of surgery, it may mean that slowly it spreads, and eventually it does cause death as well. So it's as I mentioned earlier, it's the commonest cancer in the UK.
You hear a lot of news about radiation from mammograms
That's right.
causing cancer. Is that the case, or are there risks for a woman having a mammogram? Is it?
So the brother's just asking about risk of cancer from having radiation, which you get from the X-ray. The X-ray is called a mammogram. When it's done, when an X-ray of the breast is taken, it's a special type and it's called a mammogram. So whenever the body comes in contact with radiation, there is a risk of a cell becoming abnormal. So there is a risk of cancer inherently. There's no doubt about that. But the difficulty is working out, is the risk greater of this radiation and how many people end up with cancer from radiation in comparison to the number of people that you will pick up who have cancer in their breast and the chances of them being treated and cured of cancer. So from research we know that the risk of radiation is there, but it's very, very minimal from mammograms. If you have repeated CT scans, then the risk goes up. Well, from just mammograms, the risk is very low. So therefore, the risk of cancer, again, is very low. Whereas the number of lives that you will save from doing the mammograms in all women between the age of 50 to 70 is much greater. So in balance, it is worth taking the risk of having a mammogram and finding out if you have breast cancer, which will kill you earlier than the radiation from the X-ray.
So 2 quick points about this. If, for example, a woman's mother or grandmother has had breast cancer, does that mean she's at a higher risk of having breast cancer? And secondly, the issue of gene testing, they said that there's a specific gene which is known to trigger breast cancer, and if a woman has that gene, if I remember correctly, then she needs to take certain action. So, what would you...
So the first question with regards to if a family member has it, then is there a higher chance of you getting breast cancer? There are some types of breast cancer which have a gene which is passed down from mother to daughter, and it increases the risk of getting breast cancer in the daughter. So the two questions, I guess, are linked in that sense. That yes, breast cancer can be passed on, but the percentage of breast cancers which are because of a gene is quite low. I don't have a percentage on top of my mind that I can remember, but it's less than 10%. It's a very small figure.
But should women go for this gene testing? I think Angelina Jolie was an example of this, wasn't she?
That's right, yes. So the chances of you having the breast cancer which has been passed down, the way that your GP will work out that are you one of those people is by knowing that you have 2 first-degree relatives who've had breast cancer, which means that the chances of this being genetic is very high. Or you have 1 first-degree relative and 2 second-degree relatives who have breast cancer. Or there are certain ethnic groups like Ashkenazi Jewish people who have a higher risk because they have that genetic problem within their gene pool. So there are certain people who will meet a criteria to say that, well, we know that there isn't a breast cancer, but we should check. And you mentioned that this actress, Hollywood actress, who had both her breasts taken out because of the fact that she was at risk of eventually developing breast cancer because she had the gene. So this is something that's done if we find that there is the gene. But again, that's a more detailed discussion which is done between a doctor and a patient, their circumstances and what they think is best for them. So it's not a blanket. It's a situation per situation. So there are genes, as a sort of summary, there are genes, but it's quite rare. If you've had multiple family members who've had breast cancer, then you need to speak to a GP and ask whether you need to be tested for genes or not. Yeah? So for the breast cancer, we spoke about mammograms and the fact that they give radiation, but the benefit of picking up the number of cancers is greater than the number of cancer which is caused by radiation. And we've spoken about bowel cancer, that we do a one-off camera test from the back passage, and after the age of 74 there is a test which will be started from April 2019 where everybody will get a kit posted out to them and they have to send back a stool sample. There is clear instructions which I'll go through in terms of how the sample is collected, and they will be able to tell if there's any blood, and if there is, then you have to have the camera test again. The last one is cervical cancer. Cervical cancer is something which is tested from the age of 25 with all females who are registered to a GP in the UK up to the age of 64, before they turn 65. And it is a test which is done every 3 years up to the age of 50 and every 5 years after that. The test means that we take some cells from the cervix, which is the neck of the womb or the uterus, and this tells us that these cells are normal or abnormal, and then if they're abnormal, then they need further investigations. This, again, because of the nature of the test, has very poor uptake among the ethnic communities. There is a new vaccine which is being rolled out in schools for the past couple of years, where all girls between the age of 12 to 13 are given a vaccine for a virus which is called HPV, or human papillomavirus. And the purpose of this vaccine is that it will avoid getting an infection with this virus. This virus is the most common cause of getting cervical cancer. The reason why it's not given to everybody, the vaccine is not given to everybody, is because once you're sexually active, the vaccine is not that helpful in avoiding having this virus. Once you get the virus, you get warts, and these warts predispose you to having cancer of the cervix. So, in terms of being tested for it, it's a test to look at the neck of the womb, and I'll discuss that further. I have some extra leaflets for the ladies to be able to see exactly what's done when you go through this. Now, for bowel cancer, what percentage of bowel cancers are linked to lifestyle factors? It says on here, they prepared a presentation which says, if you think it's 50% then stand up, if you think it's 20% sit down, and if you think it's 80% then put your hand up. So I don't know if people want to do that. We'll change the stand up to 2 hands, inshallah. So which one does everyone think it is? It's either no hands, 1 hand, or 2 hands. So 1 hand, and 2 people with 2 hands. So 2 hands is the A, until 50%. 80%, so everyone thinks it's 80%. The correct answer is 50%.
No
So
food.
at least half of the bowel cancers can be prevented.
Wrong answer, no food.
Sorry?
Wrong answer, no food today.
No food today. So 50%, that's half of the bowel cancers can be prevented just by changing lifestyle.
Sorry, what do you mean by lifestyle factors? What exactly?
We'll discuss that inshallah. Okay, so bowel cancer is the 4th most common. Approximately about 16,000 people die from bowel cancer every year. Half the people survive for more than 10 years. So when it's caught early enough, alhamdulillah, there's very good outcome from this. And a lot of the bowel cancers are actually linked to modifiable risk factors or lifestyle factors. This is a slide which tells us what these lifestyle factors are. So if I go in reverse, it says drink less alcohol. So if you drink more alcohol, you're at a high risk. Inshallah, that applies to none of us. Keeping a healthy weight. If you're overweight, then you're at a higher risk of getting bowel cancer. If you eat not many fruits or vegetables, by vegetables I don't mean salan or curries, because all of that, the fibre is broken down by cooking so much. It's about vegetables which are steamed or fresh, or fruits which are fresh. The high fibre helps the stool to move down the bowel nice and easily. When the food that we eat is quite squidgy and it has nothing left after the water drain out, it makes it more difficult for the bowel to push it along. And the more longer that things like this sit inside the bowel, the more likely they are to irritate the surface of the bowel. Once the surface is irritated, some of these cells become abnormal. So that's the logic behind that. Cutting down on prepared, processed or red meat. So again, something that I mentioned earlier. Smoking increases the risk of bowel cancer. So if we go through it now in the order that is written there, if you are active, you don't smoke, you don't eat processed meat or red meat, you eat a high fibre diet, you have a healthy weight, then the chances are that you will not be one of those 50%. If cancer was still going to get you, it was going to get you, but at least you lived a healthy life and you reduced your own risk. And that reduces your chance of bowel cancer by 50% if you look at it another way. So, inshallah, think about it. So, what are the symptoms of bowel cancer? If you have bleeding from the back passage, if your bowel motions are changed, so all of a sudden you normally go every day or twice a day, and all of a sudden you realize you're having to go 2-3 times, and it's been happening for the last couple of months. This is what I mean by bowel change. Or you normally go once or twice every day, and all of a sudden you find that you're only going twice in a week. This is what changing bowel habits means. So any bleeding from the back passage or change in your bowel habits. Some other factors which are generic and apply to everybody, no matter what type of cancer we talk about, is losing your appetite or finding that you start losing weight for no reason, even though you haven't changed anything. Yeah, these are generic factors which would mean that there must be an inherent problem why the body is doing this. It doesn't always have to be cancer, but it can be cancer. Yes.
What's the average weight for a teenager, for like a 14 or 15-year-old?
What's the average what, sorry?
Weight for
Average weight. So the average weight for a person depends on the gender and what your height is. If everybody could look into what body mass index is, BMI. If you just write BMI NHS, space NHS, you will have a calculator which comes up. It asks the age, it asks your height, and it asks your weight. And it will tell you that yes, you are sitting on the average weight for your age, height, and gender. Yes, age, height, and gender. Or you are above it, and this is how many kilos you need to lose, or you are below it, and this is how many kilos you need to gain. So body mass index, or BMI. If you write BMI, space NHS, mashallah, they have a very nice indicator and it tells you. Now, bowel screening. How often do you get invited to participate in the bowel screening? This is more of to check if you guys were listening, because we've just gone through it. So, A is 2 hands, B is 1 hand, and C is no hands. Which one does everyone think? No hands?
Actually, there was age range, right?
So, if you're within that age range, how often do you get called for? So 1 hand, 2 hands, or no hands?
1 hand is for the A.
C.
So everyone thinks it's
C.
How many hands for A? Let's make it easy, inshallah. So 4 hands for A. How many for B? How many for C? So 1, 2, 3, 4, 5, 6. So we have between A and C. Alhamdulillah, the A's have it. It's 2 years, every 2 years.
Isn't it 5 years between 50 to whatever age? Or age of 50?
So 50 to 65 every 5 years was a cervical.
That's what I called it. That's what I called it.
That's cervical cancer.
Oh yeah, love cancer.
Yeah.
That's
You're right, but about something else. Alright. So there's different types of tests, as we mentioned. You can have the camera test, you can have the stool sample that you send off. Yep.
Sorry. I just want to know, is IBS a contributor to bowel cancer?
No. So the question is IBS, also known as irritable bowel syndrome, a contributor to having bowel cancer? It's not known to be a contributor, but it can very easily be confused, because what I'm mentioning in terms of having some blood, having some change in your bowel habits, losing weight or increasing weight, change in appetite, these things happen in irritable bowel syndrome as well. But when it's the first time that you go to your GP and you say that these things are happening, and if you fit the criteria with your age and the symptoms, then you will be sent to find out if it is a bowel cancer or not. Once we've ruled that out, only then we say it could be IBS. And if we say there's IBS, it's just that your body can easily get irritated in the tummy. And because of that, you have all these symptoms. But it doesn't necessarily, it's not known to be an increased risk factor for bowel cancer.
This calculator doesn't work.
You've got the yappa?
This calculator doesn't work.
It doesn't work.
No. Doesn't make sense, really.
So your BMI is 25, normal is 18 to 25, you're just above. You need to lose, your healthy weight would be between 60 and 81.
Oh, between that.
Between that age
Oh,
is your
okay.
healthy weight.
I thought it says 20.56 overweight, kilo overweight.
So that's the average, so between 18 to 25, that's the BMI figure. So
Oh,
if you
right.
ask Brother Shafi, what's your BMI? He says mine is 24. And you know that above 25 is overweight, below 25 is normal weight.
That's not bad then, that's not bad. Only 2 kg overweight, man.
Right. So,
Don't need to.
when we spoke about the camera, the test that you send off in the post,
What is that?
and there is a new test again. But between the two, it doesn't matter the difference. If you're being called for it, the way you send off the sample is slightly different. But between the fecal immunochemical testing and the fecal occult blood, there's not much difference in terms of what we do as patients. The difference in the lab, in terms of what the doctor does, is that one of them, the FIT test, is better. It picks up more cancers, but it's not available everywhere yet. So this is just a diagram to say that this tube is put in from the back passage, and it looks all along the large bowel to check if there's anything abnormal inside. So this is how the scope, the camera test works from the back passage to look for bowel cancer. It is done at the age of 55, and if they find anything, they investigate it. If it's small, they can take it out there and then and tell you if it was cancerous or not. For every 220 people who are tested, it avoids one person getting cancer and dying from it, bowel cancer. So it's a lot of people that you have to test even just to save one life. But in the grand scheme of things, we think that it's worth testing 220 people than having somebody live for the next 10, 15 years with cancer and paying for that in the NHS. So that's the logic behind it. So in terms of the process, inside the tummy we have lots of food which is still being processed. And if we put a camera in, we won't be able to see anything because the food is still there. So first of all, you have to take a medicine, a drink, in the morning of the test. And this drink makes you go to the toilet many times, and it washes everything out. Once that's done, and you get to the hospital, then they give you some medicine to make you feel a bit sleepy, but they don't put you to sleep. And then the camera test is done. Once the test is done, we go home on the same day. So it's nice, relatively straightforward. There's a risk of bleeding, risk of injury, but it's very minimal. This is a test that they will do to 20 people every day, for example. One person who does the test will do it for 20 people every day. So they're very specialized and very skilled at being able to do this. So the FIT test is newly being introduced in England in April 2019, and the way that this is going to 7:30 for us. So the way that the FIT test works is that you have a little needle, and you put the needle into the stool. So you put the needle into the stool, and you collect a sample at the end of the stick. You put it back in the packet, and you send it off in the post. So it's very straightforward. Once you've done the test, you get the results. Now, if the test result comes back as abnormal, then again you have the camera test as we mentioned before. When we do the camera test and the blood is found in the poo, then 10% of those people are found to actually have cancer. So it doesn't mean for definite that you have cancer, but it does mean that for those who do, we pick them up. So what are the benefits and harms of bowel screening? If we do the test, then we are able to pick up those people who have cancer. But a lot of other people will hear that, oh, my test is abnormal, and it causes a lot of stress and anxiety. But when it's necessary, we at least do the further investigations. Some people will have some bleeding and side effects, which is problematic, but alhamdulillah, at least you've had the test and you know it's clear. So it clears your mind, and it makes the doctor happy too, to say that actually we're clear now. Cervical cancer is the next one that I'm going to discuss. This is mainly for the women. It's tested every 3 years from the age of 25 up to 50, and every 5 years from there on. 21% of cervical cancer is caused by smoking. And a lot of the other factors, the majority of the rest of it is from the human papillomavirus that I mentioned earlier. So we test for initially the cells, and the way that we do that So we've done the age of 25, that's what I just mentioned. The way that we do that is a tube is inserted into the private part, and we take a sample from inside at the neck of the room. This sample is sent off to the lab, and we test if the cells are normal or abnormal. Once we know whether they're normal or abnormal, we can test for the virus and then do more detailed testing. So this is something that we should all encourage the female members of our household to do whenever they get called for it. As long as you're registered with GP, you will get called for this, inshallah. So if this test result comes back as abnormal, this does not mean, again, same as bowel cancer, that you have cancer. However, it does mean that there are some abnormal cells which need to be looked into. So we always recommend that this is not a definitive test. The definitive test is what you have later at the hospital. The screening test only tells us that are you at a high risk or not. Yeah? In terms of 100 women having the cervical screening, we will find that 94 of those 100 will have nothing. 6 will have abnormal cells. Out of those 6, we will test them for the virus, and 2 of them will not have the virus, and they'll go back into the normal screening. But 4 of them will have the virus, and they will need the further testing at the hospital. So out of 100, only 4 get picked up. But overall, as I said, the amount that it costs the NHS to have 4 women have cervical cancer for the next 5, 10, 15 years and actually die from it, it costs more to wait for that than it does to test 100 women. So that's why we do this test. So this is again just showing what happens at the hospital. It's a camera test, again to look at the cervix, and this is done at the hospital if you have a positive test. And this is a definitive way of telling if there's cancer or not. The last one I'm going to go through is breast cancer. As I mentioned, this is the most common cancer in the UK, and we need to make sure that we are telling the female members of our household that if they have been called for the screening, then they must attend, inshallah. The screening is done from the age of 50 to 70 every 3 years, and this will allow us to pick up if they have any abnormal lumps. It is done during an X-ray of the breast. It is mainly, a lot of people have joined us, so I'll mention again that when women go for the breast cancer screening, it is near enough 100% manned by a female member of staff who does the screening, so there is no concern with regards to covering it all. So, now I'm saying, should we stop there or?
How long left?
A couple more minutes, inshallah. So, 23% of the breast cancer that we picked up in the UK is preventable. If we pick it up early enough, we can avoid it. So what are the signs and symptoms of breast cancer? If anybody notices that there is a change in the size, the shape, or the feeling on the breast, if there is any lump or thickening inside the breast tissue, if there is any leakage from the nipple, or if there's any change in the shape of the nipple, these are all signs that there may be breast cancer. So this is where, rather than waiting for the GP to send out the every 3-year test, you want to go to the GP and get tested, inshallah. So, what percentage of women who are diagnosed at an early stage 1, survive for the cancer for more than 5 years? The answer over here is 99%. So 99% of women who are tested for breast cancer through the screening are tested early enough that they would never die from breast cancer. It will be picked up early enough that it can be completely cured. So this is the benefit of it, inshallah, cooperating with the cancer screening. I think I'll end there, inshallah, because now we've covered the breast cancer, we've covered the cervical cancer, and we've covered the bowel cancer, the 3 main screening tests which are in the UK. There are lots of leaflets which are lying around, inshallah, for further information of how to be healthy and avoid all the risk factors for getting cancer, as well as certain things to look out for men and women. Please have a read inside the leaflets, inshallah. Jazakumullah khair.